Yep. Good afternoon and welcome to this webinar hosted by 100% Digital Leeds. My name's Ian and I work as a Digital Inclusion Coordinator on the 100% Digital Leeds programme. This afternoon's session is about digital inclusion and how it can reduce inequalities, particularly health inequalities, with a specific focus on the Beeston and Middleton areas of the city. You'll be hearing a bit of an introduction from me, and then I'm going to pass over to my colleague Amy, and then after her, you'll hear from some of our partner organisations. First of all, some housekeeping, which you should be able to see on the screen. We're only here for half an hour. Time is tight, so we're not planning on allowing a Q&A session at the end, but either me or Amy will keep an eye on the Q&A box and try to answer any questions as they come in there. If a question occurs to you after the session, you can contact us by going to the 100% Digital Leeds website, which you can see on your screen there, digitalinclusionleeds.com, or you can email us. I'll share those details at the end of the session. And just so you know, this is being recorded. You can see us, we can't see you. So 100% Digital Leeds is a council-led movement aimed at making Leeds the most digitally inclusive city for all. We do this by working with and within communities all across the city to build capacity, connectivity and confidence at a grassroots level and to improve digital access, skills and support for those who need it the most. We do it by working with our partners in the city, intermediary organisations, and through them we operate a tablet lending scheme. We help to connect communities with free Wi-Fi. We recruit and train digital champions to support digital inclusion activity, and we build organisational networks with information and advice to help those organisations support their service users in an accessible way. As I said at the start, you'll be hearing from two of the partner organisations we've worked with during this session. That's Turning Lives Around and MHA Communities South Leeds, formerly known as South Leeds Live at Home. What we bear in mind when it comes to our approach at 100% Digital Leeds is that digital is a means to an end. It's not the end in itself. We see digital as a tool to enable social inclusion. It's about making sure that everyone can access all of the opportunities out there, digital and otherwise, to live happy, healthy and fulfilling lives. Those without digital access and skills are likely to be the most vulnerable and excluded in our society and would have the most to gain from being online. There are tens of thousands of digitally excluded adults in Leeds, with what appears to be a higher concentration than the citywide average in both Beeston and Middleton. And the barriers that prevent people from going online and engaging with digital tools and services are commonly grouped into three main categories: a lack of accessibility, so not having sustained access to the internet, not having an internet connection, not having enough data, not having a device; a lack of skills and or confidence, not knowing what to do, being quite daunted by the prospect of doing something online; and a lack of motivation, which tends to affect the majority of digitally excluded people, the people who think the internet is not for them, they've done all right without it so far, it's not something that they feel they would get any benefit out of. And people who face these barriers when it comes to being online also can also face additional barriers that contribute to digital and social exclusion, such as disability, mental health issues, memory loss, language or cultural barriers, and generally people who may lead quite chaotic lifestyles, people who are affected by homelessness, for instance, or insecure accommodation. There's not really one measure. National research around those who are digitally excluded points to indicators such as income, age, literacy, level of education and presence of children in the home, but they are only indicators. and we are very much invested in person-centered solutions to digital exclusion that concentrate on individuals and their needs and their wants and motivations and challenges. And we try and bear that person-centered attitude in mind, and try and develop solutions that are accessible and appropriate for an individual. This person-centered, strengths-based approach means that we work with partners from all sectors who have existing relationships with our target audiences. They are often best placed to support those that we want to reach. They're the experts when it comes to working with groups we want to help. So we listen to them, we learn from them, and we work with them to help them understand the digital inclusion needs of their service users and do more to support them, embedding digital inclusion into their day-to-day support, services, opportunities, whatever it may be. And the kind of support we typically might offer includes things like digital champions training, of which we've got over 2,000 now across the city. Doing things like developing mutually beneficial partnerships and encouraging joined up working, support to access resources like funding or equipment, upskilling staff and volunteers in a general sense, signposting to existing knowledge and toolkits, and supporting to develop and pilot new approaches to digital inclusion that are suitable for an organisation and its users. We're going to focus a bit, as I said at the start, on health inequalities with this session, particularly with a focus on Beeston and Middleton. And to tell you a little bit more about what we're doing there, I'm going to hand over to Amy.
Hi everyone, my name's Amy Hearn and I'm a Digital Inclusion Coordinator, doing the same job as Ian on the 100% Digital Leeds project that Ian has just been talking about. I'm going to tell you a little bit more specifically about the work that we're doing at the moment in the Beeston and Middleton area, and how your organisation might want to get involved so that we can all work together to better improve the digital inclusion of the people that need it, working across that area. So we're working in partnership with the Beeston and Middleton Local Care Partnership and a range of other partners to look at a localised approach to improving digital inclusion with a view to reducing health inequalities. We know that now more than ever, digital inclusion is essential to people being able to manage their health and keep themselves well. Especially in the current climate, while access to face-to-face services is restricted because of the pandemic, people without the ability to get online are struggling to access reliable health information. They're struggling to access a full range of health and care services. They're struggling to access the knowledge and tools they need to better understand and self-manage their conditions. They're struggling to access peer and community support. They're also more likely to be less isolated and generally less able to make independent and informed choices about their own health and well-being. 100% Digital Leeds would like to hear from organisations working with and supporting people in this area. And the Beeston and Middleton Local Care Partnership covers the areas of Beeston, Middleton, Holbeck, Hunslet and Belle Isle. If your organisation is working with people in that area, and especially people that are more likely to struggle to use digital services for whatever reason, whether it's a lack of ability to have the right equipment to be able to get online, the lack of skills, the lack of confidence or motivation, we would like to hear from you. We're looking to work with organisations from across all sectors to help you and each other to better support the digital inclusion of the people that you work with. We'd like also to strengthen the ties between health and care providers and community organisations, identifying partners that have a shared audience so that we can all work together to better recognise when people are more likely to be digitally excluded and make sure people are signposted to the support that they need to be able to get connected, make the most of digital and be able to look after their own health and well-being. There's already some fantastic support available locally And some of our work will just be making sure that everybody knows about it and is able to signpost people to the help that they need in the best way possible and in the most supportive way possible. But we also recognise that there are gaps. Different people have different needs and need different types of support, and more needs to be done. We take a person-centred approach, and you and the organisations you work for, you know the people and the communities that you work with. You understand the issues they face. You've developed a trusted relationship, and you talk to them all the time. 100% Digital Leeds know the kind of research that's been done around digital inclusion. We know the kind of approaches that have been tried by other organisations and in other areas, and what's worked and what's worked less well. We know what resources are available, and we know who's looking to form partnerships that could better support each other. We'd like to work with you to fill some of those gaps, help make some of those connections, and bring resource into the local area to make sure that people are able to get the help and support that they need. We'd like to hear from anyone that's working locally with people who are likely to be digitally excluded from any group, but we're especially keen to hear from people and organisations that are working with some of the cohorts that we've already started to look at how we can develop support around. Those cohorts are young families, older people, people with mental health needs, and the Gypsy and Traveller communities. This is just where we've started and where the work has already begun, but we're keen to work to improve digital inclusion for people across the spectrum, living and working in the local area. If you'd like to help us with this work, just get in touch. It doesn't matter if you've done any digital inclusion work before or if you already have anything in place. Every partner's starting point and journey is different, and we'll work with you until you're where you want to be. There's no set commitment either. Your role might be really light touch. It might just be about doing some digital champions training, understanding how to identify people that are more likely to be digitally excluded, and knowing what support is already available in the community so that you can make sure people are properly signposted. Or you might want to do a lot more. You might want to identify more resource and look at developing different interventions based on the people that you support. Whatever you would like your role to be, we can help you work that out and we can help you get there. We're now going to hear from two organisations working locally who've already started on their digital inclusion journey with the support from 100% Digital Leeds. First up, we'd like to welcome Sharon Brown, who's Development and Communications Manager at Turning Lives Around, to talk a little bit about some of the work that they've done and how we've helped them to identify resource, develop their skills, and be able to offer a tailored digital inclusion intervention for their audience. Thanks, Sharon.
Oh, sorry, I did the classic not unmuting myself. So I've been speaking for the last 10 minutes. Sorry about that. Hi, everyone. My name is Sharon Brown and I work for Turning Lives Around. And Amy asked me to come to this webinar today to talk about the impact that working with Digital Leeds has had on our organisation. And of course, I was really happy to do that because it has made such a huge difference to our company. So just a little bit about Turning Lives Around. We work with people who are homeless and we provide a mixture of supported tenancies and intensive support environments or hostels. And we work with a wide range of people, anything from 16 upwards. So some of the people that we work with are very technically savvy, and then we have some people who are at the other end of that spectrum and they've never accessed the internet before or used a tablet or a smartphone. So the issue for us was that lots of our clients were being really disadvantaged, and Ian talked about people that are homeless being further disadvantaged by being digitally excluded, and this was the case for lots of our clients. As a charity, we don't have funding to provide access to Wi-Fi in any of our accommodation, and we're also unable to fund technologies such as laptops or tablets. And we felt that was really unfair, and we wanted to resolve this for our clients so that they could access all the applications that you and I use in our daily lives every day, the apps that we've probably all come to rely on. We've probably been on half a dozen apps ourselves today, and we wanted our clients to be able to have the benefit of that in the same ways that you or I do. So what did we do? Well, we got in contact with Digital Leeds, and some of the ways in which they helped us are as follows. So first of all, we were told about funding that was available that we weren't aware of, and that was crucial. So there's lots of money available for digital access, but we simply weren't aware. Digital Leeds brought that to our attention. Not only that, we were supported to actually apply to those funds, and we decided to apply for funding for iPad tablets, and also to put Wi-Fi into each of the schemes. So we did our application. Amy very kindly sense-checked that application for us. She suggested improvements and helped us to describe what we wanted to do in ways that would improve our chances of being successful. And I'm absolutely certain that without that support, we wouldn't have been successful, but we were. So we managed to get £10,000 for our clients for tablets and for Wi-Fi. And you can't underestimate the impact that this had on our service users, particularly the young people who, let's be honest, they would rather buy data than pay for food. So the fact that we were able to put Wi-Fi into services made an absolutely massive difference to those young people. And there's absolutely no way we could have afforded to do that ourselves. So that was one of the ways in which we were helped. Not only that, we were also told about two other funds, the COVID-19 fund and the BT Wi-Fi fund, and that was down to Amy again, bringing this to our attention. We applied again for those funds, and last year we were supported to raise over £20,000 in additional funding to support the digital inclusion of our clients. So we've gone from no connectivity for our clients in our services to 100% planned coverage in 12 months, and that's been entirely down to Digital Leeds. We would still be struggling, I think, to offer anything like that type of provision without that help. So that's one huge way in which we were supported. But didn't just stop there. So Digital Leeds don't just help with digital grants. They've also told us about other grants that could help our client group, in particular our young people. So Amy the other day contacted me to say, have I seen this fund that's particularly aimed at young people, so that they can further their education and employment. So we'll apply to that fund, and we would never have heard about that if it wasn't for Amy's assistance. Ian talked and Amy talked a little bit about the Digital Champions training that's on offer, and I would urge anyone to take up that training if you can. Nearly all our staff have been trained through this scheme in how to work directly with clients and how to motivate and support clients to make the most of digital. And the feedback from all our staff about this training was overwhelmingly positive. All staff said that they felt a lot more confident about helping their clients as a result of having that training. So thank you. And then it doesn't stop there, there's more. We were supported with networking and partnerships. So again, it's not just about grant funding, and it's not just about digital. Digital Leeds have linked us into other organisations that have been offering to help us to support our clients in other ways. For example, we have the funding from BT. We've been struggling to deliver to those targets because of COVID, because the idea is that we work face-to-face with clients on this funding. So Amy put us in touch with another organisation who's received the same funding, and we're learning from them how they've adapted their service delivery to be able to meet the targets. So it's just an illustration of there's so many different ways in which Digital Leeds can support your work. So just to finish, because I could go on, but I won't, just to finish, I would say that we are immensely grateful for all the support we've received from Digital Leeds in general, and from Amy in particular. They have massively helped us to improve the support we offer our clients, and I'm sure we'll be working together lots more in the future, hopefully. I would definitely encourage anyone who hasn't worked with Digital Leeds to make contact, because it has made a massive difference to us and our clients. So that's me. I'm going to hand you over now to Sarah Cooper. Sarah's a Community Programme Coordinator at MHA Communities South Leeds, formerly known as South Leeds at Home.
Hi, good afternoon. So I work for the Neighbourhood Network, as I know some of you who are watching do for older people. So we predominantly, obviously, we support older people living at home in the community. I apologise, my postman's just arrived and the dogs have gone mad, sorry. So we worked with 100% Digital Leeds before the pandemic, and Rachel and the team used to come to our activities, and we had started the iPad lending scheme prior to all of this happening, and it was about getting older people online and supporting them online, which has presented all its own challenges. So the team has lent us a library of iPads and Alexas in order for us to support our members at home. So yeah, it's come with its challenges. We've set up quite a few virtual activities. We have a coffee morning once a week, and we do a craft group once every couple of weeks. We're in the process of setting up a book group as well. So it's slowly but surely, but we've found that actually friendships have been formed. You know, there's people that have been newly referred to us in the pandemic. They've managed to make new friends. You know, the feedback that we get because of the support from 100% Digital is brilliant. But like I said, we worked with you guys before anyway. We referred into the community neighbourhood teams for the clinical staff, so with the NHS. And what we're looking at doing going forward is the NHS service that Rachel talked about. So it's about sort of bridging the gap, going in with the more clinical approach, and seeing if we can support people with prescriptions and getting online with all the NHS digital services, which, as you know, with older people is tricky. But, you know, people have mobile phones, they have tablets, the family have brought them, and what we're trying to do is we talk them through this. It does come with its barriers, but we tend to do doorstep visits, send emails across for them. But yeah, it's helped us sort of maintain some sort of normality through the pandemic, and the team themselves, like I said, you know, going forward when we get back to normal, to access and come to services and interact and work with the members, which is what we had beforehand. You know, we had coding sessions. One of the sessions that you guys did with us, which was really lovely, was a virtual tour down in Hunslet of the neighbourhood. So where people had lived, and you took the iPad round, and it showed you the image of the property 60 years ago, and it was really lovely. We got some great feedback from that. But 100% Digital have really helped and supported us and our members, and we really appreciate it. So you know, there's so much more that could be done. You know, we talked to Crossgate's Good Neighbours right at the beginning of the pandemic, and you could do stuff like virtual tours with them, the technology that we've got. You know, it's like we normally would have all had days out, you know, with our schemes at Neighbourhood Networks. But you know, you could do a virtual tour of a zoo or a seaside resort. But it's a fantastic service and really invaluable to us. And if anybody wanted any advice about setting up on any Zoom activities, we'd be happy to talk you through it. You guys at 100% Digital have given us a good catalogue of information to pass on to our members. So thank you.
Thank you, Sarah. Well, we're just ahead of time. We've got a few questions that have come through in the chat. A few about support in terms of equipment and connectivity. Amy has put some links in there to funding opportunities that have recently become available. And I've just told one of the participants about I think it was announced last week, £85 million of government funding, some of which will include streams of digital inclusion work. It may be worth having a look at those, talking to us. I am just going to share a screen which has got, I think it's just got Amy's email address on, but it's also got our general contact form on our website. If you have any questions that we haven't managed to answer, just bear with me. So you should all be able to see on your screen now the contact details for Amy and just the general team. We can help with funding opportunities. We can help let you know what specialist support is out there. If you're working with a particular group of people or a particular audience, and they may have needs that you need a bit of a hand with when it comes to addressing digital exclusion issues, we're more than happy to help. Don't be a stranger. As Amy said, we want to know about people who are doing stuff out in the community, and we also want to know about people who are maybe not doing as much as they want to do or think they should be doing in the community as well, and seeing if we can build that capacity, and in some cases connectivity. The places that need connecting with Wi-Fi need looking at funding to get that connectivity, and building the confidence through training, through partnership working, to try and get Leeds up to the point where we are the most digitally inclusive city for all, particularly as we've been saying today, with this focus on areas like Beeston and Middleton, where we're really concentrating a lot of our efforts to address issues around digital exclusion. So thank you for joining us today. I'm going to end the session now. If you do have any questions that you haven't had answered within the chat, please do get in touch with us, and we will answer them within the next few days. Okay, I'd like to thank my colleague Amy. I'd like to thank Sarah at MHA Communities South Leeds, and I'd like to thank Sharon from Turning Lives Around. Take care of yourselves.